is just a number. And to re-emphasize that fact, we have 2 doctors who will be coming up today. And they are going to actually be teaching us how to maintain ourselves, I think. I think that's more what you guys will be telling us, yes? Okay, one of them is actually a esthetician, and the other is a dental esthetician. So let's put our hands together to welcome our 2 doctors, Dr. Lynette Ng and Dr. Yeak. Okay, we're gonna just take a seat. As you can see, 他们自己保养的也是很好，看得出吗？一看就哇塞，蛮漂亮的。Okay, ladies. Okay, the microphones are ahead of you, and so are the water in case. Okay, so let's give. Yeah, is are the microphones on? Hello. Yeah. Hello. Testing 1 2 3.
Yeah, testing.
Testing 1 2 3. Okay, so let's introduce yourselves to our audience today so that they'll know a little bit more about you and what you do before we shoot. Okay.
I'm Dr. Yeak Hwee Lee. I'm from the Singapore Aesthetic Center, and we are located at the Novena Medical Center.
Yes. Okay, and so what do you actually do?
Well, basically, my areas of interest are really like skin rejuvenation and, a little bit of facial aesthetics. Yes, correct.
Okay, so by practice, are you called... I heard there's a difference between plastic surgeons and estheticians, and, people always get it confused. So, how...
Okay. I think that as an aesthetic physician, we basically do mainly skin work rather than major surgical work. And I would say that we're more into rejuvenation rather than real actual correction of, facial contours.
So
correct.
More minimally invasive
right,
type stuff.
Minimally invasive, certainly.
So that we don't look like freaks.
I think we're talking more about maintenance of ourselves rather than changing ourselves. Yes, correct.
So you look your best self rather than looking like a different person.
Yes, certainly.
Yeah.
I think it's important to just look good but natural, rather than when people look at you, she's got a nose job done, or she's got an implant or something. I think it's important to look good but natural. Yes.
Okay. Well, thank you very much, Dr. Yeak. And Dr. Ng.
Hi, I'm Dr. Lynette Ng. I come from the dental studio, and our clinic is located in Paragon. So basically, I'm a specialist by training. I'm a prosthodontist, but we do a lot of smile makeovers and a lot of teeth whitening. So a lot of aesthetic work also.
Okay, so how do these practices do they actually even work together? I mean, does doing dental work help with, facial aesthetics and vice versa?
I think it does. I mean, it's an overall package. Yeah.
And we've got lots of cross-referrals, so sometimes we get referrals for bruxism, which is like grinding of the teeth, and the patients end up with square jaws and deformed teeth who need veneers, and sometimes they come over to the aesthetics department to get some Botox to correct their bruxism, as well as correct their square jaws. Correct.
Wow, I never knew that. Yeah, you learn something new every day.
Okay, bruxism means grinding on the teeth. So if you are if you're a very stressed person, you may find that at night you grind a lot of your teeth, and then you find that the teeth become really baby small teeth with a lot of damage to the grinding surfaces. Yes.
Oh, and you can correct that with Botox?
Okay, Botox is used to actually is targeted really at the masseter muscles. Now, really, this just means that the jaw muscles right at the side here. And if you find that if you grind a lot and if you clench your teeth, you find that there's a very prominent muscle here, and you can actually just inject this particular muscle with Botox to actually cause masseter atrophy, and that would actually correct your square jaw as well as the problem of bruxism, which of course is a very major dental problem. Yeah. Yes.
I mean, for what we do is we do build up the teeth, so you can use veneers. You have to wear a mouth guard, but then if you Botox, then it helps both to reduce the forces during bruxism, and then it corrects that square jaw. So it's a very nice overall package.
Now, a lot of people always think that dental estheticians, my first thing is like braces. And that's the most, so what else does dental Oh, I keep tripping over this word. Esthetician do.
Basically, we do a lot. I mean, the least invasive is teeth whitening. So all you have to do is just change the color of your teeth. So anything that is whiter will make you look younger. For some patients, they're not so keen on braces, okay, because of the time, or you have to put certain brackets on. Then if the crowding is not so great, you have the option of veneers. So veneers are like little thin ceramic pieces that you can stick on teeth, and you can change the shape. So if you want, we can show some slides.
Sure.
So these are what some people call instant braces. So for example, if you have a slight crowding, we do a mock-up for you. We show you what's possible. And then if you move on to the next slide, this is possible in 2 weeks. Okay? So with porcelain veneers, it's actually a very thin piece. I always tell patients it's like an acrylic nail, and you stick it on. It's permanent. So you can permanently straighten teeth, and the color change is permanent. So you can actually come in and specifically choose a color versus like teeth whitening, which is not so permanent.
How long does teeth whitening last?
Teeth whitening varies. It depends on your diet. So it can be anything from 6 months to a year. But you have the option of maintenance. So you can get like little maintenance kits, which are home kits, and you can wear the trays every 3 months for 3 days. So like for myself, for the forum, so I did my whitening. And it's, yeah, you just do it at home. You can do it 1 hour a day, 30 minutes, or you can wear it to sleep.
You mean the whitening toothpaste doesn't help?
No, it doesn't help. Basically, whitening toothpaste just contains abrasives. So if you overuse them, you can actually wear the teeth down. And they're only good for external stains. So you have a lot of coffee, tea stains, okay, you can use them. But it doesn't change the base color of your tooth. You need chemicals like bleaching agents.
Okay. Since we already have you talking, why don't we just ask you a couple of questions about dental esthetician, and then we shall move on to the face. You know, because work from the in out. Okay. Okay. So, well, you know, that's how I work on it. So, now is teeth whitening suitable for everyone? Because you were talking about whitening your teeth.
Yeah. Basically, you need to make sure that your teeth are in good condition first, so no decay, no gum problems. You also have to make sure that the external layer of your tooth is not too thin, and you don't have any sensitivity problems.
Okay.
Other than that, we have to come in and assess the color. So let's say if your discoloration is caused by antibiotics, then you're not so good for whitening, because you can't remove the stains as well. Then you might want to consider porcelain veneers.